Okay, we're continuing. This is part 5 of Prevent and Reverse Kidney Disease by me, Pete Rogers. We're going to talk a little bit about potassium today. And so I'm going in through the FAQs, frequently asked questions. So the first one is, how come I say fruits are good when they're so high in potassium? The vast majority of kidney patients can handle eating a lot of potassium. It's only as their renal function gets worse and worse that they'll have a tendency to become sensitive. Some of them might have a little more problem, but most of them handle it pretty well. You can check your blood labs and see how your potassium is. You should, be frequently monitored. Once you hit CKD and you got a GFR below, glomerular filtration rate below 60, you should be working with a dietitian or a physician or some other health expert, somebody who knows what they're doing, and then somebody who can get lab values on you to see how you're doing and how you're handling your potassium and everything else, okay? Because most people, again, they excrete potassium just fine. Our kidney's made to excrete potassium, okay, rather than to retain it. Fruits do have way more potassium. I've given separate lectures, and I'll have a list somewhere in this book about what is the K factor. K factor is the ratio of potassium to sodium. So our ancestors probably ate about 10 to 20 K factor, 10 times, 20 times more sodium than potassium. More potassium than sodium. In the modern world, people tend to eat the opposite, 10 times as much sodium as potassium with these modern diets because of the processed food. Potassium is an ingredient from inside the cell in a whole food. When you process food, you smush it, rinse it with water and solvents, and you rinse away all the potassium, the intracellular ion. Same thing with magnesium. So that's why processed food is terrible. It's low in potassium, low in magnesium. Those are the things that help prevent high blood pressure, for example. If you eat, one person gets into more advanced kidney failure, then they might be retaining potassium, and that becomes a problem. And they can eat lower potassium foods, like starches are lower in potassium, for example. Okay, and like I said, you're going to need somebody to monitor your levels. And then here's the next question. What foods tend to have the most potassium relative to sodium? Well, that would be the highest K factor. So fruits have the highest K factor, much more than starches and then veggies, then meats, then processed foods. And we'll talk more about this later in the section on hypertension. What about paleo, keto, carnivore, low carb? And that's all a bunch of nonsense. You have to remember, if the public actually knew about low-fat vegan, then they would dramatically reduce their amount of hypertension, diabetes, kidney failure, coronary artery disease, etc. That would change the whole economy, change the whole healthcare environment. So big money doesn't want that. They're not going to let that happen. They've got billions of dollars. To them, $1 million is nothing in marketing, okay? You see me and making these great videos telling you the truth. What do I get? 100, 200 views, maybe 300? They can pour so much money into promoting their videos. They can easily get 1 million views on whatever topic they want. So they can spread an opinion much more readily than anybody telling the truth could. So it's always going to be that way. The average stupid person is going to be tricked into believing the opposite of the truth. Paleo, keto, carnivore, low-carb diets are a disaster for health. You plug up the arteries, you cause hypertension, obesity, diabetes, kidney failure. And now I'll get some trolls saying, oh, he got healthy on a carnivore diet. Yeah, right. Okay, it's not sustainable long-term. Any diet you can short-term get a benefit from it, called the Hawthorne effect, because you're paying attention to all the details, but long-term you're not going to sustain it. The people do terrible eating those types of diets, okay? And that's been shown on numerous studies. That's old news. Okay, yeah, they usually just hire some good-looking person about 40 years of age to promote the diet, and all the stupid pros say, oh, I want to look like that person. They don't realize that person probably doesn't eat that diet. Okay, another thing is, how can I be so sure I'm right and the high-fat phonies and the other ones are wrong? It's because, I've read the old books. If you read Walter Kempner, John McDougall, and, Nathan Pritikin, it's so obvious that, fat is a loser, meat is a loser. All those things are bad for your health. Walter Kempner, the low-protein, low-fat, 100% vegan diet, was curing people of, coronary artery disease, diabetes, atherosclerosis, the things that cause kidney failure, and keeping these kidney failure patients alive a lot longer than they would be because there's no dialysis back in those days. The Kempner diet was just white rice, which is only 1% of calories from fat, has about 7 to 8% of calories from protein, fruits, fruit juice, and a multivitamin. That was his diet. If patients were losing too much weight, he let them have sugar. Okay, he liked table sugar because there's no nitrogen in it, unlike protein. There's no sodium in it. There's no phosphorus in it. Those are things you might want to reduce when you get into advanced kidney failure. Kempner diet was about 93% carbohydrate, 4.5% protein, fat about 2.5%, really low, and also very low in sodium. The reason it's so low in protein is because the fruits are very low in protein. Okay, and then of course, like I said, sugar has no protein in it. Kempner said that his diet had the lowest amount of protein, fat, and sodium of any therapeutic diet, and he intentionally designed it that way. He had incredible results, routinely reversing obesity, hypertension, and type 2 diabetes. He also published many cases of reversing diabetic, hypertensive retinopathy, coronary artery disease, and congestive heart failure. What more do you want? He had better results back then than people get nowadays, and pills don't cure these diseases. Can't cure a dietary disease with a pill. You don't want to try this on your own. Kempner was monitoring these patients pretty closely. It's basically Kempner ran the equivalent of a nutrition ICU. Dr. McDougall called it diet for the nearly dead. A lot of these people were really sick. That was their last chance, was to hopefully Kempner could save them. Some paleo-keto carnivores try to discredit Kempner, saying that he just starved the patients. But that's not true, because they had positive nitrogen balance. Okay, and their serum albumin levels were followed and they were improving. So those are patients being fed. Starvation patients, the opposite would have happened. Okay, Kempner pointed out that a high protein, high carbohydrate diet has a protein sparing effect. And James Mitchell, PhD from Harvard, talked about this in his YouTube video. You can see it at the Wilhelmi Bilkinger Clinic channel. Because fasting causes more urinary excretion of nitrogen than does the rice diet. With fasting, the body breaks down its own protein to convert it to glucose, and this requires removing nitrogen from the amino acids. This nitrogen then is excreted by the kidneys. But Kempner, with the low protein diet, there was more glucose available, and they didn't have to break down so many amino acids for gluconeogenesis. Okay. The sodium-potassium ratio in the urine of patients on the ordinary diet is about 2. But Kempner's patients were excreting very low sodium, so on their diet it would be 0.003. Okay. I've got videos about Dr. Kempner. Dr. McDougall's got videos about Dr. Kempner if you want to learn more about him. Before dialysis became widely available in the 1970s, like around 1972, the low-protein diet was well known to protect kidney failure patients. Low-protein diets were the standard treatment. Then big money came along and started making dialysis available through Medicare, but it also then sort of faded out the low-protein diets. Conveniently, they were forgotten. It's not profitable to do that. And there was this really lousy study called the MDRD, which prescribed rather than actually follow the diets, and the patients answered survey questions. They weren't closely observed or monitored, and a lot of them didn't follow the diet. And they didn't have that great a benefit from the so-called survey study of a low-protein diet, but that's not a fair study. And so that was used to discredit the low-protein diets. I'm sure that was intentional. Other nutrition experts like Nathan Pritikin, Jeff Nelson, John McDougall, Caldwell Esselstyn, Goldhamer, myself, we've seen really good results in patients eating these low-fat, low-protein diets. From an epidemiology point of view, the populations who eat low-fat, plant-based diets like Old Okinawa, Tarahumara in Mexico, Yanomami, South America, Chinese and Japanese before 1970, they had much lower rates of hypertension and diabetes, the gateway disease to kidney failure. Okay, so that's it for today. I hope you found that helpful.